Good evening. We're Team Lindsay Harkins, and we're doing our presentation on COVID-19 data in the coming months.
The COVID-19 pandemic also has been referred to as the most crucial global health calamity of the century. From the way we live to the way we interact, and more importantly, the health of our citizens, COVID-19 continues to pose a challenge for the world in which we must navigate. The goals for this project was to identify case trends in Florida, as it's been a talking point throughout COVID. We used Excel predicting in order to figure out the case count over the next 3 months. We mined US data in order to predict future COVID trends. And we used Azure in order to interpret how COVID cases will look like in the next 3 months.
If you look on your left, you'll see a chart displaying COVID cases over the past 3 months and continuing predictions for the next 3 months. The solid blue line indicates COVID cases in the last 3 months, and the dotted blue line indicates what we predict will be COVID cases in the next 3 months.
The dotted blue line is a regression, an exponential regression that predicts the next 3 months. We expect it to grow approximately 500,000 cases. This is without any external factors like the vaccinations. And yep.
For the US data, we used Microsoft Azure in order to use our data to test and predict the cases for the future. So we obtained a data set from the Johns Hopkins University, and we used Azure to split it into 2 groups, a training group and a testing group. 75% of the randomized data was used to train the data, and 25% was used to test the data. We used a linear regression because we've seen in the past that COVID has remained a linear growth trend. And we were able to have a high coefficient of determination at 0.99362, which you can see in the bottom right corner. And when we deployed our experiment as a web service, our predictive model was able to get very close to the actual number of cases. You can see the difference between the 2 numbers is only a few 100,000 or tens of thousands.
So in conclusion, we were able to find in our research a slight exponential increase in cases, which we should expect in the next coming months. And while data leads us to this conclusion, we also must account for outside factors like the immunization possibility, which could be coming up in the next few months as well, which will become more prevalent in Q1 and Q2 of 2021 as more people have built up immunity and companies race to distribute their vaccines in public.
Thank you for listening and stay safe.